Hey everyone, Dr. Charlie Johnson, physical therapist, and today I have some really cool stuff to share with you, and it's going to be all about headaches. So one of the big questions I get is that when I'm working with people who have headaches, and I'll talk about the specific types of headaches we're talking about, I am able to push on certain parts of their neck, and actually it causes maybe their eye pain or their pain on the side of the head. And so, people are kind of amazed when I'm able to push on the neck and actually send pain somewhere other than the neck. And that's really at the bottom foundation of some of the things that we know cause headaches that originate from the neck. There are so many different causes of headaches. I believe somewhere, last count, was over 300, but really some of the headaches that physical therapists treat best include something you probably heard called tension headaches, okay? Tension headaches are usually headaches that kind of like form like this vice or like this headband-like pressure across the head and extending into the temples. And it's usually actually on both sides, and it actually can be related to tension or stress. Another one of another type of headache that is commonly treated by physical therapists are headaches that originate from the neck. The fancy term, not that you need to know this, but perhaps you haven't looked it up yet, is cervicogenic headaches. Cervicogenic headaches is the other type besides tension headaches that we traditionally treat. And again, it's just a fancy way to say headaches coming from the neck, basically. So with that being said, I have a drawing here, and what you're looking at is you're looking at the a kind of a side view of a person as if they were standing and facing this way. There would be like, so that would be like their eyeball. And what you're seeing here is that when we talk about headaches, okay, pretty interesting, going back to the whole idea of, when I push on a joint in the neck, how can it possibly send pain or be the cause of my headaches that I feel in, say, my eye or the side of my head? Well, pretty neat, okay? When we actually look at how the body is structured, we see that the most common cause of headaches that stem from the neck and or tension headaches is actually the joints in the upper neck. So you have many bones in the spine, but you have specifically 7 bones in the neck, and the 3 ones that you really need to be concerned about if you have headaches and you're watching this video are the top 3 joints in the neck. So forget about all the others in the spine. If you have headaches, you really want to focus in on the top joints in the neck, right at the base of the skull and just a few underneath. So you can see here, this green line right here represents the base of the skull. So it sits on the first block in the neck, or the vertebrae, and it kind of allows for a rocker. So the first joint in the neck, between the base of the skull and the first bone, allows us to kind of nod our head, okay? So it allows us to say yes and say no. The joint or connection between the first bone and the second bone allows us to turn our head, okay? Over half of our ability to turn our head, right and left, comes from the connection between the first and the second joint. So you can see that these are really vital joints as far as head and neck motion, okay? And then the connection between the second and the third joint, not sure there's too much special about that, but what you need to know is that is actually the most common kind of joint that we find a problem with in people who have headaches that are either tension or cervicogenic coming from the neck, okay? So the key thing is that the second and third joint that's fine. Second and third joint, the connection between the second and third bone is really the culprit when it comes to neck pain and headaches, and to somewhat less, but still a high degree, the joints at the base of the skull, okay? So big take home, the upper 3 joints in the neck can actually cause headaches. Now, how do they do that? Well, let's see. So what's really cool, okay, is that the joints below, when we get down to the joints in the lower neck, they send signals down the arm. So we have a bunch of nerves that travel down the arm, okay? But the joints here, they actually have nerves that connect to the base of the brain, and there actually is a kind of a pool of nerves at the base of the brain that allows signals to be sent to the head. So at the base of the brain, so you have your brain here. Okay, so at the base of the brain, there's actually a pool of nerves that these nerves, 1, 2, and 3, all link into. Okay, so you have 1, 2, and 3. So the upper 3 joints, all those nerves actually link into the base of the kind of brain, which has a center that, pretty cool, allows for kind of signals to be sent up here, and up here. So these 3 joints send 3 little wires up to the base of the skull, and then from the base of the skull, there's actually 1, 2, 3 wires, so to speak, of coverage. Okay, so again, it allows us to kind of feel things. It gives us sensation, our ability to sense touch and things like that to different areas in the head. Okay, now I've really marked this up, but let me show you something. Okay, so because of that connection in the brain, and because of how this little pool at the bottom of the brain allows us to feel these 3 big areas of the face, well, that link allows me to push, okay? Take my finger, or maybe even you could at home, you could actually push on the back of the neck, and you may actually feel some signals kind of up in different areas, okay? What's really cool about this is that if you push, the higher you push up near the base of the skull on the neck, the highest joint up in the neck, the higher or the farther it actually refers the signal. So let me kind of explain that, okay? So if I or you are at home and you take your finger and you put it on the base of the skull and you push right on it, maybe on the side that you have your headache, so you're pushing here, you will actually feel that pain somewhere. Yeah, right here, of course, that's where it hurts, but it'll actually send pain maybe somewhere up in here, okay? Now, go a little bit lower, maybe just take a finger width down and push a little bit lower, or if you were to have me or somebody else do it, we push here between the first and the second joint, and yeah, you feel pain not only there, but now you feel pain right here. So you, for the last one, okay, the connection between the second and the third joint, you push here, and not only do you feel it here, of course, but you feel it maybe right here. Pretty cool, right? So the point is that the higher you push in the neck, or the higher the problem is in the neck, the farther you may feel the symptoms. Really high, you may feel it up at the eye. A little bit lower, you may feel it kind of in the temples. And at the lowest point between the second and third joint in the neck, you may feel it not only in the neck, but you will also feel it maybe right behind the ears or something like that. Okay? So, pretty cool stuff. Now, what we have to understand is that there are a couple criterion to determine if a headache that you're having is coming from the neck. Okay, first things first, you may have headaches that are triggered by you just moving the neck. Okay, so if you move your neck and you notice, oh man, that might cause a headache or it might bring a headache on, then that's one sign. The other thing could be is that you may have neck pain. Pretty obvious, but you'll probably have neck pain, and the neck pain won't just be really low, you'll actually feel it kind of on the side and maybe extending down a little bit, okay? But it'll be high up in the neck on one side. You will have stiffness, okay? Stiffness in the neck, meaning you won't be able to turn your head as far, okay? So, big things. Let's write these down for you guys. We're going to write them in the head. So it's triggered by neck movements. Number 2, your headaches. Okay, you have pain in the neck. Now, this pain in the neck starts at the back of the neck where those joints are. Remember, we were pushing on those joints. We were getting them moving back here. And where did the pain go? It radiated to wherever, that specific level was, okay? So pain in the neck starts in the back and radiates to the front, okay? So kind of, yeah. Starts in back to front. Hopefully you can read that, okay? Okay, cool. So you have headaches that are triggered by movements of your neck. You have pain in the neck that starts in the back and radiates to the front. The other thing I mentioned earlier is that although this can be on both sides, the headaches can be on both sides, usually the headaches are one-sided. Again, a little disclaimer, it could be on both sides, but usually one-sided headaches. The next thing is that the motion in the neck is impaired. So it's more difficult to turn the neck one way versus the other due to pain, stiffness in the joints in the upper three neck, or in the upper three joints in the neck. Remember, we talked about how important the joint between the first and the second bone is in allowing us to turn our head to the right and to the left. So decreased motion. And really the way that you can tell if you have decreased motion is you can kind of perform a little self-test. So all I want you to do is I want you to bring your chin towards your chest, and I want you to try to turn your head to the right and to the left. All you're looking for and all you're trying to ask yourself is, is it harder to turn one way versus the other? So chin to the chest. So to the left and to the right seems fine for me, and there's really no big difference. But for you, if you have neck pain and headaches, you may notice that you just have more soreness on one side and it just doesn't go quite as far. So that's what you're looking for. And then the next thing. You may have just tenderness to some of the muscles in the neck. The joints are a little bit deeper, obviously, than the muscles. They're beneath the skin, beneath the muscles. So you might have to push a little bit harder to feel some pain in the joints. But just touching the neck, some of the skin and some of the muscles, just kind of on the surface, might be pretty tender. The final thing that's kind of interesting is that you may be watching this, you may be taking medications for headaches that perhaps your physician prescribed, or maybe you're just taking over the counter, and it might not be doing much of anything for you. So that's kind of another alert that might be pointing you more towards the fact that these headaches are actually coming from the neck rather than, say a migraine or something that you might be able to take medication for. So meds, cross it out, not really working for you. So those are the big things when we think about all the key players and contributors to headaches that are coming from the neck. Cervicogenic headaches, if you want to call them that, that's the fancy term, or tension headaches, but really headaches that are stemming from the upper three joints in the neck. So big picture, you have all these key points. So you can walk yourself through each of these and ask yourself if these things have an impact on your neck pain, your headaches, but also understand that the most common culprit, the most common stiff joint that we see that can cause neck pain and headaches is the second and the third joint in the neck, although the top three joints in the neck are all key players. You can kind of forget about everything else when it comes to headaches for the most part, and understand that the way that the joints, the upper three joints in the neck, can actually cause this pain to travel is because they're linked into the base of the brain, where kind of that pool of nerves is, and that pool of nerves has a connection to different parts of the head as far as allowing us to feel different sensations in different regions of the head. So those are take-homes. If you're watching this video, you've had headaches for a while, you've been to different places, it's very common that people treating these headaches don't feel comfortable treating the joints in the upper neck, or they simply just don't know how to properly assess it or evaluate it and determine if it's a problem. So I've given you some tools. Again, if you have headaches and it seems like you're answering all these questions, and you have a lot of these things that I talked about today, then it could be that your headaches are stemming from the joints right below the base of the skull. And really, with some good hands-on treatment, we can clear things up pretty quickly. So with that being said, I'll leave my email. I'd like you to reach out to me if you have any questions. If this sounds like you, or maybe you're a little bit confused or want me to clear something up, I'd be more than happy to. So let me write down my email, and please feel free to reach out to me. So here it is. Charlie Johnson, DPT is in Doctor of Physical Therapy @gmail.com. Reach out to me. I'll be sure to get back to you. Thanks.